yung research nyo, it showed the high compliance in NCR with the health protocols. Can you tell us more about it?
Well, we did a non-commissioned survey, and we surveyed about 600 respondents in Metro Manila, and what we see is around 93% of them say that they comply with wearing face masks. Of course, this is the I think 93. I'm pulling up my 93%, around 93% the NCR. They say they use face masks. Of course, iba yung what they say and what how they wear it. Yeah, kasi yung proper wearing of face mask. Kasi aside from this is a survey, but we actually also did it's like a survey, but what we did, and hindi pa namin na-release to, is we sampled people wearing face masks by looking at pictures. And dito, it's much lower. It's about 80%, I think 75 to 80%. So I don't have the exact number, but it's somewhere within that range. It's in one LGU, sampled over, but I think this was done last October, I think. Hindi pa namin na-release yung results na yan.
So, ibig sabihin niya, there's a 10 to 15% difference between those who say na, nagmamask kami, and then on the other hand, doon sa isang exercise na hindi nyo tinanong, tinignan nyo lang kung if they're really complying.
Exactly. So, sometimes there's a difference between perception and reality. Ako, I feel na face mask naman ako, pero most of the time, nasa baba pala. Then, it doesn't count. But at least, if the 10% is across the board, then that will help us then discern other, survey results, such as cleansing of hands, face shield. Ito, kunyari, avoiding crowded places. 37% lang nagsabi na they do that. So apparently, people, yung pagka-inform sa kanila, what they think is, as long as we're wearing face mask, face shield, and then hand sanitizing, kasi ito yung top 3 na and then physical distancing, they feel na they're okay. Kasi ito yung top 4 na sagot nila eh. And yung pinakamababa doon, yung social distancing, which is about 73%.
You had a survey on vaccine attitudes now. We're talking about mindsets. Pero hindi nyo tinanong, 25% lang are willing to be vaccinated in the NCR. Are you planning to conduct a survey, follow-up survey on the reasons for the vaccine hesitancy?
Yes, Amy, we are actually planning to do exactly that kasi hindi nga nakaspecify yung reasons and hindi rin nakaspecify yung type of vaccine that they might be more inclined to avail kung available ng mga vaccines na to, because we didn't specify yung country of origin. For example, sabi na natin, suppose we have a vaccine that's available and that's proven to be safe, would you have yourself vaccinated? And 25% said yes, 28% said no, and 47% the rest said not sure.
One final question, Doctor, because we've been hearing this from the different LGUs, particularly we heard it from Makati, we heard it from Quezon City, we heard it from Navotas. It's not exactly anecdotal, but they're the first to admit also that it's not necessarily the biggest or the most scientific surveys, but everybody's saying there's a particular hesitation when it comes to Chinese vaccines. Do you intend to conduct, or do you in fact already have some idea on the perception of and openness of people when it comes to the different vaccines from the different countries?
Yes, actually, that should be also included yun nga, this follow-up survey namin. And this is anecdotal lang. I don't have the results or statistics to back it up, pero based on kunyari, sa mga comments na nakikita ko when we have these interviews, and there are also people who ask questions. May nag-interview sa akin sa isang station, and the listeners were asking about the type of vaccine. Sinasabi nga nila, kung Chinese, they're more hesitant. I mean, that's what I'm hearing. This is anecdotal, so I don't have the statistics to back it up. But this seems to be the sentiment that I'm sensing from people. So it would be interesting to know if we could put it down to a number, ilan yung magtitiwala sa, let's say, sa Pfizer, sa American brand, American vaccine, and why? Bakit sila magtitiwala sa Western? If, for example, pareho naman silang efficacy and parehong FDA approved, would you still choose this brand over this brand? We know that part of the problem is also some people have this perception that the cost will be a factor to them, especially some socioeconomic class D and E, and that's why they're siguro a little less or a little more hesitant to be vaccinated than A, B, and C. Kasi mas mataas yung yung yes dun sa A, B, and C compared sa D and E. So it could be more of perception, information, or yung cost. They might be worried na they would have to pay for these.